Hi, I'm Dr. Paul Sanghera, and I'm Co-Medical Director of Clarity Eye Institute. Clarity Eye Institute is a 5-site, 25 ophthalmologist practice, and we service over 8 hospitals throughout the Greater Toronto Area. We've remained open during the Covid-19 pandemic to service patients that required emergency and urgent care. We also recognize that as restrictions lift and the economy is set to reopen, and offices are set to reopen, there may be some apprehension for our optometric colleagues, our medical colleagues, and patients in general in terms of what that might look like. The purpose of this video is to show you what we have done at Clarity Eye Institute in terms of instituting safety protocols for patients and ourselves to ensure that patients are seen safely and effectively. And we hope that this might be of some benefit to you when you open your practice. Clarity Eye Institute has staff that have trained in COVID infection prevention protocols, and we're happy to provide them as a resource in case you require a visit to your office to ensure that best practice protocols have been instituted. We also have access to PPE procurement through our own private networks. If any of these services are necessary, please contact us. We're more than happy to help. We're all in this together, so please stay safe, and as a team, we'll get through this together. Thank you.
SARS-CoV-2 is a positive sense, single-stranded RNA virus. Spread is via the virus coming into contact with the epithelial cells of the respiratory tract, meaning your mouth and your nose, or your eyes. This occurs in one of 2 ways. First, respiratory droplets, which is coughing, sneezing, or speaking in close contact. And the second is contact transmission, which is the auto-inoculation of contaminated surfaces to susceptible human cells using your hands as a vector. Protecting oneself from respiratory spread and contact transmission is the basis of using physical distancing and personal protective equipment. Clinicians will protect themselves, their noses, their mouths, and their eyes from respiratory spread by using equipment such as goggles, face shields, surgical masks, as well as keeping distance from patients as much as possible. Patients will do the same by wearing their own do-it-yourself masks at the very least, as well as maintaining distance. And hand washing and sanitization is very important to prevent contact transmission. In an ideal work setting, general distancing principles dictate that the patient-patient and patient-staff paths should cross minimally and interactions should be limited. This means that patients should have separate entrances and exits, that only essential tests and diagnostics be performed, and if in a multi-doctor practice, strategies put in place to contain or distance one clinician's patients from another as much as possible. We will talk about these strategies in detail a little later on, and obviously recognize that office layouts are varied, so the ideal distancing principles cannot strictly be adhered to often. Relying on the common sense fallback of maintaining space, ensuring all patients wear masks, and minimizing unnecessary conversations, as well as having access to frequent hand washing, will mitigate any office space limitations. At Clarity Eye, our screening process begins on the phone prior to the visit. Patients are asked the now familiar pre-screening questions of fever, cough or sore throat, shortness of breath, recent travel, exposure to any known COVID cases. Also, as 3% of initial presentations of COVID are acute conjunctivitis, any patient with redness only and no loss of vision or photophobia are asked to convalesce at home for 14 days. Patients with redness and pain or photophobia are asked to send a photo, which we then triage. At this pre-screen, patients are also advised to bring a mask and limit companions to 1, and preferably ask any essential companions to wait in their vehicles if possible during the appointment. At Clarity's front doors, patients are again asked the pre-screen questions and must agree to a temperature assessment before entry. As stated previously, Clarity staff interacting directly with patients wear masks and gowns, and face shields are advised. Our front desk staff wear masks, and all front desk areas with patient-staff interaction should have physical separators such as clear plexiglass. Patients are asked to line up for check-in by adhering to physical distancing rules. If there is a backup or delay in the day, such that the waiting room fills, newly arrived patients will be checked in at the front door, and once a temperature is taken, are asked to return to their cars. They are then contacted via phone call or text message once ready to be seen. Our clinicians and staff arrive in street clothes to our clinic and change on-site into scrubs and lab coats or gowns at the beginning of each clinic. Changing into shoes that do not leave the clinic is also advisable. We then undress and change back into our original clothes at the end of clinic. Dirty scrubs and lab coats are either laundered on site or placed in a sealed bag and laundered immediately when returning home. We advise our Clarity staff to don PPE in the following sequence: washing or sanitizing hands, then gowning or using a lab coat, followed by masking. Once a mask has been fit properly, we ask our staff to not touch the mask again until it's ready to be discarded. This is followed by using a face shield or goggles, and finally re-sanitizing the hands. We advise our staff to re-sanitize hands or wash hands or use a new pair of gloves in between each patient. Doffing of PPE occurs in the following sequence: washing or sanitizing one's hands or removing gloves, then removing the gown or the lab coat. You then would wash or sanitize your hands again and remove the face shield or goggles. Again, hands are washed or sanitized, and the mask is removed by the ear loops or ties, paying special attention to not touch the mask itself. This mask is then thrown in the garbage, and hands are washed or sanitized one last time. Patients should be assessed in clean rooms that are clearly demarcated. The examiner should pay attention to what was touched by the patient, including chairs, occluders, phoropters, and parts of the slit lamp. Slit lamps and BIOs should have modified breathing barriers installed. Single-use minims should be used in preference over bottles, if possible. For intraocular pressure, non-puff tonometry, such as an eye care, tonopen, or applanation tonometry should be used. Puff tonometry and lacrimal irrigation may be aerosolizing and should be avoided for now. Face-to-face examinations should be brief, and patients should be instructed to not speak during the exam. Lids should be manipulated using Q-tips, not fingers. For cleaning of diagnostic equipment, please refer to the COS Covid19 portal for excellent equipment-specific resources and tips for cleaning. Once elective surgery becomes operational, our office will consistently utilize the principles discussed. Patients will be distanced in space and time to allow for ORs to safely perform much-needed elective ocular surgeries. We anticipate that all intraocular surgery may conservatively be deemed aerosolizing. Therefore, positive pressure airflow rooms, such as those used in hospital ORs and at Clarity Eye, may be the only locations that these surgeries, including cataract surgeries, RLEs, and ICLs, may be permissible in the short term. As stated previously, patient flow needs to be separated as much as possible in multi-practitioner offices. In the event that this cannot occur safely, options include extending hours and staggering doctor shifts with a full cleaning of the office in between shifts, and multi-doctor offices where doctors service more than one location should consider centralizing practices to only one location in the short term. These strategies ensure that should an outbreak occur in your practice, it may be justifiable to quarantine a single doctor and his or her team only, rather than the entire office.
If you have any questions about the video that you've just watched, please contact Clarity Eye and we'd be more than happy to answer them. Once again, stay safe. We'll see you in our offices soon, and together we will all get through this. Thank you.